Well, welcome everyone to this webinar for the announcement of funding for the Children's Mental Health System of Care. And we're pleased to be able to present this particular webinar for potential tribal applicants. And I want to share with you a little bit of history and background, and then turn this over to Andy Hunt from SAMHSA. So this is the 2017 funding opportunity announcement for the System of Care expansion and sustainability cooperative agreements, and a particular opportunity for tribal applicants. I'm Terry Cross. I'm Senior Advisor at the National Indian Child Welfare Association, and Nick was a partner with the National TA Network at the University of Maryland. Our goals today are to increase the understanding of the purpose and goals of the Comprehensive Community Mental Health Services for Children and Their Families program, commonly known as the System of Care Grant Program. We're going to walk through with led by Captain Hunt, each element of the funding opportunity announcement and provide tips for successful applications. We hope that our webinar encourages tribal applications and you get some questions answered along the way. So it's my pleasure to introduce Captain Andy Hunt, is the Senior Program Management Officer with the Child, Adolescent, and Families Branch, the Center for Mental Health Services at SAMHSA. Andy?
Thank you, Terry. So, yeah, just one of the things that we're doing here, as Terry said, this is a webinar that we want to focus on specifically for our tribal applicants. So some of this will be information that was presented in a previous general audience webinar, but we are going to take a tribal focus on it. So I work with all of the tribal grantees under the Systems of Care grant program. I also work with our Circles of Care grant program, and I've been at SAMHSA for 10 years now. Prior to that was with the Indian Health Service and a variety of detail assignments for 15 years out in the Pacific Northwest, and my last assignment with Indian Health Service was working with Terry at NICWA to provide technical assistance to the System of Care grantees. So that's the perspective I bring on this, and I'm going to go through the slides, and we'll also talk about some questions and tips for you. So these are some general slides about SAMHSA's strategic initiatives as of 2015 to 18. We have 6 strategic initiatives that guide the work of SAMHSA, and you can read those there on the slide. SAMHSA works on its grants through what they call the theory of change. So it's taking a practice from the point of innovation to going all the way through the phase of wide-scale adoption. So early on with the Systems of Care grant program back in the 90s, it was an innovative program, and over the years it has showed itself to be effective. And so we're at the point now where we are encouraging the wide-scale adoption of the Systems of Care approach across the nation, and hoping that our grantees will spread the System of Care work within their own jurisdictions. Okay, so we're going to talk a little bit about the historical perspective of Systems of Care. You can see here that since 1993, when the program was first authorized by Congress, we have awarded 299 grants so far. Out of those, 50 are tribal grantees. So that's 15% of all awards, which is really pretty good for most federal grants, I would say. These are tribes are competing with cities, counties, and territories for the states for this fund, so that's pretty good. In the 50, we are actually counting some of the cities and counties that have had contracts with tribal organizations, so not all of those 50 are directly funded to tribes themselves, but most of them are. So you can see that we've got a good history of funding tribal and Native communities with this grant program. We've pretty much touched every state in the country and several of the U.S. territories as well over the years. One of the things that you should know about the service delivery context of this work is the SAMHSA CMS Joint Bulletin that was issued in 2013, which this basically authorizes states to bill for Medicaid for all of these different types of services that are really part of what the system of care approach is. So the funding opportunities are there for states under this Joint Information Bulletin. There's also some rules around the home and community-based services that also present opportunities to bill for services that may be provided under a system of care approach. So at this point, I want to kind of go through the funding opportunity or FOA announcement and just walk through the process. So hopefully you have had the chance to review the application. It is a rather lengthy application, so we wanted to take this opportunity to kind of walk through it with you and make sure you have a good understanding of what is required and what we're expecting. So the due date for this is January 3rd. We expect between 5 and 15 awards to be made. The funding for this would start in basically next October for the next fiscal year. The amount of award for state, we allow states to apply for up to $3 million a year for statewide initiatives. So political subdivisions of states, which means counties, cities, also territories and tribes are able to apply for $1 million. So as a tribal applicant, $1 million is the amount that you can request. There is matching required, which we'll talk about later. This is a 4-year cooperative agreement, and the eligible applicants are public entities. So again, that means cities, counties, states, tribes, and tribal organizations, and any of the U.S. territories. Something that you need to know about SAMHSA grants: if you have applied for a SAMHSA grant in the past, there is a new process. SAMHSA is transitioning to the National Institute of Health ERA grant system. So before you apply for a SAMHSA grant, you need to go onto this website and register for the ERA. If you click on that link or go to the samhsa.gov/grants page, you will find all the instructions you need to get yourself registered on the ERA system. They strongly suggest you do that 6 weeks prior to the due date. I suggest that you start the process as soon as this call is over. And if you really are interested in applying for SAMHSA grant, to just get that going in case there are any unexpected delays. But that is a new requirement for SAMHSA grants. So at this point, I'll ask if there are any questions about the actual submission of the application.
Andy, this is a question that comes up is on the slide that says that you can apply for up to $1 million. That's for each budget period. Is that correct?
Correct. So that's $1 million per year over the 4-year grant period. Right. Thanks for asking that clarification. So a total of $4 million over the entire life of the grant, but each budget year is $1 million.
Thank you.
Okay. So let's move on. Talk about in the FOA, the first section is the purpose. So really the purpose is to improve behavioral health outcomes for children. We're focused on children and youth aged birth to 21 with serious emotional disturbance, SED, and their families. Now we use that language not because maybe we have other language that we might prefer that's a little less pathologizing, but the fact is that that's the language that's in the legislation that we're authorized. So you will see the language serious emotional disturbance or SED throughout this grant, and that's why, because it's in the statute. So it basically, we're encouraging you to work with youth who are experiencing serious emotional issues. The other thing about providing services is that we do expect that is going to get to the wide-scale adoption of the system of care approach. If you remember the theory of change slide, we want you to provide mental health services and supports. So this is a service grant. It is also a infrastructure grant. So it's focusing on the creating this sustainable infrastructure while also changing the way you provide services. So we are also, with this application, encouraging you to look for youth who may be showing signs and early symptoms of a serious mental illness or first episode psychosis. And then we also expect this grant to address the behavioral health disparities that may exist in your communities. Again, this is what we call a hybrid grant. So it is meant to change the infrastructure of your mental health system, the system that serves children with mental health needs. So I should say it's not just the mental health system, but all of the systems that are involved in working with children who might have mental health needs. So it's a systematic approach to infrastructure. We do expect you to provide direct services. Services should start 6 months after the grant award. And as we've said earlier, there are 2 levels of grant applications for states and basically everybody else, including tribes. So I'm going to skip over this part about states with the one exception. So as you're listening to this webinar as a tribal organization or a tribe, and you listen to it and you get to the end, you think, well, this sounds great, but I'm not sure we're ready to engage in this work. You might want to find out if your state is planning to apply at a state level, and states have to identify at least 2 local jurisdictions to work with on the implementation. So if you're in, I'll say, Wisconsin, and the state of Wisconsin is going to apply, you might want to talk with someone at the state to say, could we be one of your local jurisdictions if you feel like you're not quite ready to take this on your own. So that's just a bit of strategy for you as you think about how the states are implementing these grant programs. So the next section really gets to talking about tribes and tribal organizations. We want you to demonstrate that you are working with your state, specifically the Medicaid agencies, because as you know, Medicaid billing and Medicaid goes through the states. So you can provide services and you can bill for Medicaid, but your state is still going to be the one that processes it. They're the one that set the rules of what is allowable services and those sort of things. So it is important to work to create a relationship with your state. Also, if there's a state mental health agency, again, for the same reason that we expect you to figure out how to work with them, and this is for the purpose of sustainability. We want you to develop your tribal systems, but also realize that you're part of a system within a system. We would, in the attachments, we would like letters from the tribal leadership demonstrating that there is a commitment to broader systems level change. Some of you may have applied for grants in the past where there was a requirement to pass a tribal resolution saying that you were going to submit the application. We're not requesting or requiring a tribal resolution because we realize that that process often takes too long and is too political. So really what we're looking for here is that the tribe is committed to doing this work of circles of care, or systems of care, sorry, and that the tribe is committed to making broad systems change. This could be, again, simply a letter from the tribal chairman or something to that effect. What we're trying to avoid is having a program director in a community write an application for the tribe, and then turns out that the tribe really didn't know about the application. So we want to make sure that the tribe itself is committed to the work and knows about the work that you're proposing. Some of the other expectations we have is that we expect you to work on a governance structure around policy making for interagency coordination and collaboration. So this is not talking about creating a new tribal council or new tribal governance or anything like that, but really getting at sort of a community involvement over the decisions related to children's mental health work. So that may be part of what you may have a tribal council that's got a health committee or something like that that may serve this function, or you may have other advisory boards, or you may need to create a new governance structure advisory board or something like that. Kind of depends on your situation. We also want you to be involved in some of the, if there are any youth treatment programs available in your area, either through the state. This talks about the state, but some of you might also have some relationships with the IHS youth treatment facilities, so that would be good to discuss as well for referral purposes. We expect our grantees to develop a culturally and linguistically competent social marketing and communication plan. This is due by the end of year 1, and we expect a strategic finance plan, which is due by the end of year 2. There are certain key positions that we are requiring. There's a principal investigator, which is at least 0.05 FTE. The principal investigator is typically someone who has just general oversight. Maybe could be someone like a tribal administrator or someone like that who has a administrative oversight just from the broader tribal perspective. A project director who's focused specifically on the work of this grant, and that really needs to be at least a 0.75 FTE or a full-time position. This is a complicated grant that requires a lot of time and attention to detail, so we do expect that you identify a project director to work specifically with this. Along with that is what we call a lead family contact. So there's a partnership that we encourage between a project director who might be professional master's level or PhD level or however you choose to do that, and a lead family contact who may be someone who is more of a community-based leader. We expect that those two folks work together to have the formal and informal perspectives. There are a few people that we expect you to identify as task leads. These are based on some of the deliverables, so how you choose to do that is up to you. We expect there to be somebody identified as a task lead for clinical service delivery, for cultural linguistic competence, evaluation, social marketing, which we do specify needs to be at least half FTE, and youth engagement. So these are some of the tasks that need to, kind of key roles. Exactly how you choose to fill those could be staff, could be split 50-50, could be contracts. There's any number of ways that you could propose to do that in order to get the work done. One of the things that's required of all SAMHSA grants is to develop a health disparities impact statement. So if you were funded, then no later than 60 days you would be required to submit a disparities impact statement. We are focused on recovery, and there's some definitions here about how SAMHSA defines recovery. The population of focus, as I've said earlier, birth to 21. The SED definition, as you can see here, this is that it has to do with having a diagnosis through the DSM or the ICD-9. And then if you're working with children under 3, there's another diagnostic tool called the DCO3R, or the DISC. So any of those as a way of marking the diagnosis for children. We also, in addition to a disability, a diagnosis, there needs to be some sort of disability or inability to function in multiple areas of life, including family, school, community. So if you've got a child who is in special education, has a mental health issue, may also be involved in child welfare or juvenile justice, substance abuse, has health care needs, any of those situations. Again, we're looking for sort of the more complicated, serious issues. And we expect the disability to be for at least 1 year, and that multi-agency intervention is involved. So those are the youth that we're really primarily focused on through this grant program. You can select a population within that entire birth to 21. You don't have to serve every child birth to 21. You could choose to serve those who are at risk or having a first episode psychosis. You could choose to focus on youth who are involved with the juvenile justice system, or youth who have health care issues with primary care, or youth who are in child welfare, any of those. You could choose youth with co-occurring. You could choose early childhood. So, any of these different ways. It's really whatever you as a grantee would like to focus on. So you can focus on the entire birth to 21, everybody, or you can sort of focus on any of these different areas in a variety of ways. We do expect that families and youth are integrally involved in the planning, governance, and implementation and oversight. We expect you to develop those mechanisms to promote and sustain the youth and family participation, and we strongly encourage the use of peer providers, which is family and youth. So one of the things to remember is that this is about a systems of change program, not even a program, an initiative, system change initiative. So this is really more than about just bringing in the outside experts, but it's really tapping into the expertise and input of youth and families themselves. We do expect collaborations across child-serving agencies. So again, this is not just about building a mental health, quote, program. It's about working with all of the different agencies that serve children who have mental health issues. We expect you to develop some crisis response capacity and have a strategy for that, talking about trauma-related activities, and this may be historic trauma, how you deal with that. We expect you to engage in some outreach and engagement, so finding kids who may have these issues, especially looking at the early onset, severe emotional disturbance, serious mental health issues, other youth who are often hard to reach. So we expect you to go out and find them and try to bring them in for help. We also expect you to create flex funds to be able to serve those needs in unique ways. So some of the collaboration that we are looking for between different SAMHSA grants, some of you may have other SAMHSA grants. If you do, then we encourage your different SAMHSA projects to work together. And we'll just skip right through the next. We're going to try to go really quick because we've got a lot of material to cover. So I'm not going to talk about every bullet here. there are some required activities that are listed on page 13 to 15 in the FOA. These are actually activities that are listed in the statute that are required by all grantees to deliver these services. One thing I will note is that we are not expecting you to actually deliver all of these services as a program. So you may not have 24-hour emergency services in your tribal mental health program, but if you have access and you have an agreement with, say, the county system or something like that, so we expect you to provide these or have them be available. So some of these may be through contracts or agreements with other partner organizations, not necessarily that a mental health program is providing all of these itself. In some tribes, that's not going to happen. So we want to make sure that these services are available as needed for youth and children. There are some other services that are allowable besides those required activities. We expect you to coordinate with your IHS or Tribal 638 clinics. Some of the things that you can do are needs assessments. You can look at enhancing your computer management systems and software, how to work together. And we do encourage you to use various forms of technical, telehealth and other sort of technology that can help you coordinate and reach the youth who need services. So with that, are there any questions about expectations, required activities, or allowable activities?
Andy, one of the questions that came up in an earlier discussion was around the portion of the grant or the cooperative agreement that is about services versus the building of the infrastructure. I think it may come up in a future slide, but there's a lot of infrastructure pieces to this.
Right. So we'll actually talk about the infrastructure piece a little bit later in the webinar, but that is, it's important to kind of keep in mind that in addition to providing all of these services, we do expect there to be an infrastructure developed to help sustain these services and the partnerships that are developed. So anything else related to that at this point?
No, I think that covers it. Thanks.
Okay, so we'll move on. Excuse my speedy pace and fast talking. Usually not talking as fast, but we've got a lot of material to cover in a short amount of time. So one of the things that happens if you get a grant is that we will have annual grantee meetings. These are technical assistance opportunities for training for grantees to get together with each other. At these grantee meetings, we ask that you bring at least 10 people, including the key staff, task leads, and any partners that are mutually agreed upon by yourself and your government project officer. And we ask that you bring these 10 people to at least one system of care training activity per year. There are times when this is one big grantee meeting that everybody comes to. There are other times when these are smaller topical related grantee meetings. But the important part here is this is a training and technical assistance opportunity. There is a requirement to attend that, but the purpose is to help you develop sort of a critical mass of people who understand the work of systems of care. That's why we ask for 10 people to become involved, because it's not just about building the knowledge of your project director, but again, that sort of critical mass. So this is something that will happen if you are funded in your grantee meeting. So it's something that you will have in your budget for the grantee meeting. So we've already talked about this a little bit. Again, we're talking about $1 million for tribes. This is a 4-year grant, so the way SAMHSA does grants is that you apply for the entire 4-year grant, and then each year you have to submit a continuation application, which is basically an abbreviated version of the grant application with a new budget each year if there are going to be changes. One of the things that tribes are often concerned about is the question that comes up is $1 million, is that for direct or indirect? It is for both. So if your tribal indirect rate is 15%, congratulations, and you'll have to take 15% out of that. If your tribal indirect rate is 46% or something like that, then you'll have to take that off the top as well. So unless your tribe decides to, if you can talk to somebody and tell them not to charge indirect on this grant, that's fine by us, but most of the time tribes want to do that. So whatever your approved IRS indirect rate is, you are eligible to apply that amount to the award, which of course reduces the amount for direct services. But that is $1 million direct and indirect costs. And here again, we've already discussed the eligible applicants. It's basically governmental entities. So if you're a tribe, if you're one of the 567 or 8, whatever the number is today, federally recognized tribes, then you are eligible to apply. Any tribal organization within one of those tribes is also eligible to apply. Some of you who are not eligible is if a grant was awarded for systems of care in 14, 15, or 16, they're not eligible because they're actually currently will be receiving funds, so you can't have 2 of these grants at the same time. Yeah, we'll just leave that one at that. Hopefully that doesn't apply to anyone who is listening to the webinar. If you already have a system of care grant, and you will have a system of care grant in October of 2017, then you are not eligible. If you have a system of care grant currently that will end before that, then you would be eligible. So talk a little bit about the cost sharing and match requirements. So this is a little bit of a question that has come up many times before. This is a statute. The requirement for matches is in statute. So there's, unfortunately, we've had questions from tribes before about waivers. We've had formal processes to go through, and this is the way it is. It's part of the statute. So the match for this grant is that for the first 3 years of the grant, the grantee must provide $1 for every $3 of federal funds. So if you requested $1 million in year 1, then you are required to provide $333,333 in non-federal funds to go towards the work of the grant. So it's important to remember that when you're counting match, that you are counting things that are actually going towards this grant. The matching funds follow the same budget categories of the federal budget. Sure, so your budget will have a federal portion and a non-federal portion. So if you have a person who is a tribal employee, and you're going to say that if you were awarded the grant, that half of their time as a tribal employee will be spent working on this grant, then that half of their salary that's a tribal salary would be counted as non-federal match. One of the things about for tribes, that probably comes up later, but I'll say it here, is that any 638 funds that you get through IHS or BIA you are able to count those as match. So if you have a 638 mental health services and you've got somebody who works in that facility under a 638 contract and you want to have them work on this grant, that would be non-federal for the purpose of this. Same thing with BIA. If you 638 your IHS or your ICW program, you could do the same thing. The challenge with the match comes in the fourth year, where it goes up to a 1-to-1 rate. So if you are going to spend $1 million in federal funds in the last year, then you must identify $1 million in non-federal match. There was a webinar that was done back in February. Hopefully, when you're viewing this, you can click on that webinar that link to watch the webinar that was specifically talking about match. If you have specific questions about this related to your community, then I would be happy to take those questions via email or phone call. So one of the things is that the applicants must show that your needs are consistent with the priority of the tribe or tribal organization. And so again, this gets to the point that we don't want just someone who is a project director or a staff person in a department to apply on behalf of the tribe if the tribe is not aware, and to make sure that this work is consistent with what the tribe feels is a priority. So for states, we're asking them to provide a state or county needs assessment or something to that, so there's some documentation that we can see that children's mental health is a priority for the tribe. So if there's any such tribal document, then you can provide that. If there's hasn't been a study or anything like that, then however you can document the point that the children's mental health is a priority for your tribe. Any questions about eligibility? Okay, we'll move along. Yeah.
I'm sorry, I was on mute here.
Okay.
Just a question about eligibility. If the tribe had like a graduated site, having had one of these grants in the past, are they eligible?
Yes, as long as they're not currently funded, or what will not be currently funded when this grant is awarded, which is basically October 2007. If the grant ends before then they would be eligible. So previous systems of care grantees are eligible to apply for this through this FOA.
Great, thanks.
Okay, so we'll press on further. Some of the limitations that are on this funding opportunity is that no more than 20% of the grant can be used for data collection, performance measurement, data assessment. So this is your evaluation work, and that can be no more than 20%. This is an infrastructure grant, but we expect no more than 30% of the grant to be used for infrastructure. I would say that you should count on 30%. You should maximize that amount of what you're putting towards the infrastructure. So this means paying for the time and positions and all the other work that's related to building the policy and program level work. The remaining grant must be for direct services and supports. And one of the things that you need to do in your budget is to identify which of these costs in your budget are related to the data collection and for developing infrastructure. So as you're writing your budget and your justifications, that's something that you will need to identify. There's also some standard restrictions on SAMHSA grants, so hopefully you will look this up. The funding opportunity announcement, actually, it's a good point, has two parts. So what we've been discussing right now is under the funding opportunity announcement part 1, which is basically the description of the program itself, what we're asking you to do. Part 2 of SAMHSA funding announcements is a boilerplate for all SAMHSA grants. So any SAMHSA grant that you apply for, whether it's this or any of the other 30 or 40 or so, however many grants that that SAMHSA is going to be putting out this year. Part 2 will be the same for all grants. So that's basically describing the process of the grants management, how you apply it, how you can manage grants. There is something specific about the systems of care that the law authorizing this program prohibits funds to be used for substance abuse treatment and other non-mental health services. So if you're expecting to use this to start a youth substance abuse treatment program, you'll need to look for a different grant because that's not what this is for. You can provide substance abuse treatment if the primary condition for the youth is a mental health issue, and they need substance abuse in order to improve their lives or recover. Then that's okay. But this is not about developing a substance abuse treatment program. Any questions about funding limitations or restrictions?
Andy, this is not just about the funding restrictions, but we noticed that there's a Circles of Care announcement at the same time. If a tribe is not familiar with the system of care approach, do you recommend they look at this grant or the Circles grant?
Yeah, so this is one of those years that happens every 3 years when the Circles of Care grant program comes out at the same time as a Systems of Care grant announcement. So just a brief side note about that. Circles of Care is a 3-year basically planning grant designed specifically for tribes and tribal organizations and urban Indian organizations. Circles of Care does not require, well, states and counties and cities are not eligible to apply for Circles of Care. So it's about, Circles of Care is a planning grant. So if you're listening to this webinar and you hear all this talk about systems of care and providing services, and it's really, you're kind of they're going, what is this all about? I don't understand this system of care stuff. This is an opportunity to think about more long-term process and maybe apply for a Circles of Care grant instead, where you can have 3 years to plan your own approach to what a system of care might look like in your community, rather than jumping right into a system of care. There's no prerequisites. It's not like tribal communities have to complete a Circles of Care grant program to apply for this systems of care. It is often helpful. So the choice, you guys, if you're thinking about both, a tribe really needs to make a decision looking at carefully at both options depending on your current situation, and weigh whether you want some time or you need some time to think more long-term and come up with a plan for how you can work with your children that might take some time and end up with a unique model for your community through Circles of Care, or if you feel like you're ready to jump in and provide services and also develop the infrastructure, then that would be Systems of Care. So obviously Systems of Care is a $1 million grant that requires some matching funds, so in that way it's, as a grant itself for a cooperative agreement, it's a little harder, the grant's management burden is a little bit more. Circles of Care, which there's a separate announcement you can find on the SAMHSA website, is a 3-year grant for $418,000 a year. So they're similar in terms of the concepts that underpin the work, but the most simple way to think of it is Circles of Care is for planning and development, and System of Care is for providing services while also implementing systems change. So if you're listening to this and you're thinking, which one should we go for, those are your options that you kind of need to weigh.
Thank you.
And one other note about funding restrictions, a question that has come up before, and just to clarify, SAMHSA does not pay for construction. So there can be no construction on this. There is a small amount, I think it's limited to $75,000 for renovation. If you're thinking about that, I would strongly encourage you to look up the federal government definition of renovation because it's a fairly restrictive definition. So if you watch TV shows like any of the the home repair shows, some of the stuff that they're doing that looks like renovation is actually considered construction. So a lot of things that people sort of from watching TV think is renovation is construction and not allowed under a SAMHSA grant. So I would encourage you, if you're thinking about anything like that, about renovating or doing any facilities like that, go to the look up the federal definition under grants as what they mean by renovations. So just a bit of warning there from some other previous applicants. So one of the things that grantees are required, all grantees are required to collect information on performance and data collection. For the System of Care grant program, we have a national evaluation for specifically for the Systems of Care grant. So as part of the grant, you will be participating in this national evaluation. We have training and technical assistance to help you with this. And hopefully in collecting this data, SAMHSA is able to show the impact of the work of Systems of Care, and you as a grantee are able to use your own data to show how the work that you're doing is making an impact. So you are required to collect and report data on certain infrastructure because this is an infrastructure grant, and we will provide you with those specific measures and all the details about those things. So the details would be provided after your award, but these are some of the activities that will be required in terms of evaluation. One of the things that we have is that you can look up this link for the GIPRA measures. This is something that for all of the children that are receiving services, this particular GIPRA measure is across all grants within the Center for Mental Health Services. The national evaluation is evaluation just for the Systems of Care grants. And this slide here is talking about evaluation and measurement for all of the grants received under our center. So if you had a couple different grants under the Center for Mental Health Services, you would be collecting this data across the board for all of those grants. So it's baseline 6-month follow-up and discharge data. So this is outcome data, again, so that we can report on the impact of the grants that are being provided and the work that we're doing. So we can continue to justify to Congress that this is a program worthy of funding. We also expect you to do some periodic performance data. We review, so we will require progress reports. In the progress reports, we expect you to talk about some of the barriers that you've encountered, how you overcome the barriers, and the reports will be at least annual. Sometimes they're more frequently than that. It kind of depends. It may be either biannual, but at least annual. We provide a simple suggested template for reporting this. This is basically a progress report. So not a huge deal, but that is something that we do need grantees to do. So let's move on. Any questions about data collection or data measurement? Well, so I think one of the questions that comes up occasionally is who should do this? Who should do the evaluation and performance measurement? Typically, most tribes contract this out to a local university or a firm, a contracting firm that does evaluation. A lot of times those folks will be sort of outside evaluators that might work with a local person that you've hired to work directly as a tribal member or a tribal employee to do the evaluation. So there's any number of ways that you can do this. If you have the capacity in-house to do it as a tribal organization, that's great. If you need to contract it out, that's fine too. Just make sure you use a contractor that is going to meet your needs. We'll talk a little bit about this at the very end, but if you have an evaluation contractor in mind that you would like to work with, that's fine. However, they cannot help you write this grant. So don't go calling your evaluation person and say, hey, can you write part of this grant and help us out? Well, you're allowed to do that, but then they cannot be a contractor on your grant. So we'll talk about that at the end, but there is a regulation that prohibits contractors from competing for contracts under grants that they helped write. So just a little fair warning about that. Any other questions about data collection?
None that we can think of here.
Okay, so we'll move on. The next section is evaluation criteria. So again, this is evaluation of your application. How the application that you submit will be evaluated by the reviewers. So it's based on the scores that you receive and the quality of your responses to the evaluation criteria. That you need to talk about your responses in terms of the population of focus that you've selected. So if you've selected, let's say, early childhood, birth to 8, then you should write about that. The project narrative section of the application is sections A through E, and it needs to be no longer than 35 pages. As you're writing your grant application, you should follow the format of the criteria that's in each section. So each section A has a number of bullets underneath there, or numbers. So you'll need to address each one separately. So A1, A2, etc. If you don't put that in there, then it will not be reviewed by the reviewers because they are instructed to review that way. So if you write a beautiful paragraph describing exactly what you're going to do, but that paragraph does not identify which evaluation criteria it's dealing with, it won't be scored. So please make sure that you follow that format. The number of the points available for each of the sections is in that section. So reviewers are looking, and they will decide whether you get basically a 1 or a 5. That's how they weigh the scores. So each bullet, they'll look at making sure that you've addressed all of the bullet points in the evaluation criteria for each section. So a little bit of a tip for the requirements. Some of the things that you should focus on are listed here. Your population of focus. Make sure that you're cross-referencing the required and allowable activities. They're referenced in the previous section of the FOA. Talk about the data collection, grant meetings, funding limitations. It pretty much follows the format of the FOA. So here's the basic outline of points that are available for your narrative section. Again, no more than 35 pages. There are some specific criteria for 35 pages in terms of font size and margin. All that kind of stuff is the details of that is in the FOA Section 2, so I'm not going to talk about that so much right now. But there are sections A through E. You can see that each one has a different level of points. The statement of need, there's 5 bullets worth 25 points. Section B, proposed services infrastructure, is worth 20 points, and there are 4 bullet points. Section C is expectation requirements. There's 30 points for that, and there's a number under those. Section D, 15 points for staff management relevant experience, and then 10 points for your plan to collect data and performance measures. So that's pretty much the structure of the bulk of your application needs to follow that. That's pretty much the outline, so you just need to fill in the details of what you're proposing. So in doing this, what we're really suggesting is you're telling a story. And you want to tell a story so that the reviewers understand what you're talking about. The reviewers for this particular grant application will be people from outside of SAMHSA. So SAMHSA staff and contractors do not review these grant applications. Our Office of Grants Review selects reviewers based on their experience and expertise, and they are asked to review the applications as peers. So most of the people that will be reviewing these applications have experience as project directors for these grants, for evaluators, or for other people who have other experience working in and around the various systems of care. You know, as we said earlier on, we've had 299 of these grants funded, so there are a large number of people who have been engaged in this work over the years, and some of those will be the ones who are reviewing. So those are the people that you're writing for. We encourage you to tell the story, you know, just what they need to hear. You know, sort of try to keep it brief and make sure that each of your points follows the narrative. So just thinking about the sort of storytelling approach, make sure that you're telling a complete story and also cross-referencing the criteria that are in the FOA in terms of the required and activities and expectations. In the budget section, you'll need to provide a justification, existing resources, and other support. So your budget narrative, there is an example in Appendix B. So the format is an example format. It's not an example from a previous grantee. So ignore the details that are in there as far as FTEs for salaries and cost of meetings and things like that. It's the format that you need to concentrate on to be able to use that. If you don't use that budget format, it makes it a lot harder for the reviewers to look at. So please review that and follow that format. Make sure that the budget reflects any funding limitations or restrictions, and make sure that you identify the costs that are associated with your data collection and with your infrastructure, because those are the two things that were specifically required that you identify in your budget. Some of the last things in your application will be the supporting documentation, so biographical sketches and job descriptions. These are people that you are hoping or thinking that will be part of your work if you are funded. I think the most important thing is to make sure that you have set the ideal qualifications and descriptions of the positions that you want to fund. You may have somebody that's identified. You may have John Smith, who is your person who's right now doing work that you want to have do if you get funded, and maybe it turns out that by the time you get this grant, John Smith has moved on to greener pastures and is no longer an employee. That's fine. We would look for you to replace somebody with who is equivalent to John Smith's expertise and experience. So likewise, if you name somebody in one of these key positions and then for some reason there's a change and you decide that that person has, for whatever reason, you don't want them to be in that position anymore, naming someone in this grant application is not a promise of employment or guarantee of employment. So we do want to just make sure that you understand the work and that you understand the kind of person that you need to find to do that work. Section G is confidentiality and participant protection. So this is where you would describe how you are going to help protect the confidentiality in services and how you're going to do the participant protection in terms of the evaluation and things like that you're doing. So if you have an institutional review board or IRB, you probably want to talk about that. However, you can to address those issues. So again, make sure that you're going to be spending a lot of time writing this application. Make sure that you meet all of the technical requirements in the application. So review the criteria very carefully. It's not just that you're writing a great story for a journal or for a book. This is for a grant application. So there's the specific format that you will need to follow. Make sure you review the eligibility criteria. If you have any questions about that, you can contact me or any of the other staff. Before you submit it, you need to double check all of the requirements to make sure they don't get screened out. And that includes things like page numbers, font sizes, margins, all those sort of things that seem like details. Unfortunately, we have had grant applications that were not reviewed because of these what seem like little technical details. So that's just the way it is. Please make sure that you double check so that you're not getting screened out for some technicality. Make sure that you have all your forms and make sure you follow the page limits, especially with the electronic submissions. I'm not sure exactly how this is going to work with the new system, but follow all of those instructions strictly. So as you're writing in the grant, the process, make sure that you're getting letters of support, memorandum of agreement that may be required or maybe good ideas that you want to do, gathering the CVs or resumes, writing your job descriptions, making sure the character count, page limit, scanning your documents for electronic submission, whatever kind of the federal forms that are required, your budget. So all of these different things, there's a lot that goes into to submitting the application beyond just writing it. So make sure that that if you're a grant writer, that you've got a team of people that are working with you on your staff, or if you don't have a grant writer, that you've got a grant team that's working together and everybody knows their part to make sure you can get the application submitted so it is reviewed. One final tip for tribal applicants, there is a pretty nice review or document that was developed by the Office of Juvenile Justice and Delinquency Prevention, OJJDP. It's a couple years now. So if you want to go to this website, the tribalyouthprogram.org, they have an online guide that is written with their grants in mind, but there's a lot of good tips there about just general grant writing. So if you're new to grant writing, that would be a good resource to look at. So any questions about all of this evaluation criteria for your applications?
Kind of a technical question about match. In the case of a partnership with a school, and the school is going to provide office space and counseling space for school-based program, how much how much detail is needed? Is it just in the budget justification to describe that, or does that need to be documented in a letter of agreement for the purposes of the application?
Well, so there would be both. So in the actual budget and budget justification, as I said earlier, the budget follows the federal budget category. So you've got personnel, fringe, I can't think what they are now, travel, other consultant, those standard, as you're looking at the budget section, which I don't have in front of me. There'll be the federal request. So what you're talking about is space that's provided in kind. I think that would go under the other category. So basically what they're doing is providing you a space that you may have had to rent if they didn't provide it to you in order to provide services. So under the other category, you would say something about space provided by XYZ school, 3 offices or something like that, whatever it is. And then you would have to create the value of that. So what is the standard going rate for per square foot or for an office space, however you want to identify it, but that there is some sort of standard that you've come to identify the value of that, not just pulling it out of nowhere and making it up, but to say, okay, well, if we needed to rent this office space anywhere else, it would cost us $500 a month or something like that. So you would put that in the budget in the line item, and then under the justification, you would provide the justification of how you came up with that cost and what the room space would be used for. If it was going to be used for interviewing or providing counseling or something like that. And then if that XYZ school was going to do that, it would reinforce that if in the letters of support that was specifically identified, saying that we, the XYZ school, are donating 3 offices that valued at whatever costs they were valued at. So I think approaching it from that point where you're putting it in the actual budget itself that's submitted, and then you back it up with a letter of support that affirms that is what's going to be provided. So that would be my suggestion on that in terms of match. So match can be from any of the categories. Typically it's salaries. A lot of times it's space. So if you're thinking about space, then you need to come up with what the market rate is for in your area. Obviously, an office space in somewhere in South Dakota is going to be a lot different than office space somewhere in New York or downtown Detroit or something like that. So having a standard for being able to determine that and value it is important.
Great, thank you.
Okay, so we'll move on. And this is, again, getting back to the competition regulation. I referenced this earlier. This is 45 CFR Part 74, which is a federal regulation regarding competition of contracts. So it says that in order to ensure objective contractor performance and eliminate unfair competitive advantage, contractors that develop or draft grant applications or contract specifications, requirements, statements of work, invitations for bids, and or requests for proposals shall be excluded from competing for such procurements. In other words, as I said earlier, if you're a contractor and you're helping someone write a grant, that's fine. You can be a grant writer and charge or not. Doesn't matter if you charge or not. It doesn't say anything about writing for a fee. It says a contractor. So if you're a contractor and you're helping a tribe write an application, that's great. You've done your job as a grant writer. You may not write yourself in to a grant, as a contractor. So if you are working with, if someone listening to this is an evaluator or is a tribe working with an evaluator, or any other contractor for that matter, who says, I can help you write this grant, and they help you write this grant, and they also put themselves in for a nice contract of doing whatever evaluation or whatever other type of training or whatever work, that's not allowable. So this is, unfortunately, has been a common practice, but we are clamping down. This is one of the things that the General Accountability Office, the GAO, has looked at and trying to avoid this. So again, I would encourage you to make sure that if you are a contractor, that if you don't write yourself into a grant. If you're a tribe hiring a contractor, don't ask them to help you write the application and then award them a grant. They cannot receive, if they help you write the grant, they cannot receive any contract after you've awarded this grant. You can contract them for something else doing another grant or some other funding, but you can't use, they can't compete. So I'll probably said enough about this, but this is something we want folks to be aware of. So after the application is submitted, we hope that you'll put together the best application you can, but I encourage you to not let your efforts at systems change stop if you are not funded. Unfortunately, as we know, everybody who submits an application is not funded. We do have a limited amount of funding, and there are scores and things like that. So you may put together, what is your best application, and it might not be scored well enough to be funded. Don't feel too defeated, and I encourage you to think about taking what you have done and figure out how you can take these ideas and move forward with them on your own. Hopefully writing the application has planted a seed for systems change. And a lot of these times you can take the work that you've described, and with the commitment of tribal leaders, you can often take the existing resources and say, this is a really good idea that we described, so let's figure out a way to make it happen and do it on our own without SAMHSA's help. So it is possible. I speak from personal experience. When back in the 90s when I worked at the Puyallup tribe, we applied for one of these grants and were not funded, and I thought there were some very important things in the application that we described that I thought that we could do with just within the tribe itself. So so we did that. I had support of some of the leaders, and we started to make some of these changes that we talked about in the application. So so you can still use this application writing as a process to help promote change in your community. So if you are awarded a grant, the notice of award will be emailed directly to whoever is named as the business official in the grant application. There's no paper copies. It's a direct email that goes straight to that person listed as the business official. It will most likely be sometime in mid-September, and the anticipated funding is no later than September 30th. I will make a little note about the business official. So for many tribes, they name the business official as the tribal chairman. And depending on when your tribal elections are, you could name someone in your, the tribal chairman in your application when you submit it in January, and if you get funded by the time mid-September comes along, or there may have been a change in leadership through an election. So it's the applicant's responsibility to make sure that SAMHSA has the current information on who the business official is. So whether that's a tribal administrator, whoever is named as that, if that person leaves between the time when you submit the application and September 30th, then if they leave, then and you don't tell us, the grant award notice is still going to go to that person's email. So you'll need to make sure that you keep that up to date and submit that with, make sure that grants management knows that you've had a change, and they'll help walk you through that to make sure the right person gets the information if there is a change in business official. This is the last chance for any final questions about the funding opportunity.
Andy, I don't think there are any more questions, but I really want to thank you for doing such a thorough job going through the funding announcement.
Well, thank you. So I hope that this does, provide you guys with, whoever's listening to this, you have a better idea of what is expected, some tips on how to move forward. If you have additional questions, if you have questions that are tribal specific, then please feel free to contact me either by phone or by email, and I'll be happy to help you think through or talk through any specific questions that you might have. If you have questions about the process of submitting your application or anything related to grants management or budget issues, then Gwendolyn Simpson will be the person that you'll need to contact, and her phone and email is there. So anything related to kind of the programmatic, what are we supposed to be doing? Can we do this? Can we do that? Those are things that I can help with. If you have questions about, well, how do I submit this and how do I log on to the EHR, those sort of questions, what do I do about grants.gov, those sort of things all go to Gwendolyn Simpson. So with that, I believe that is our last slide, and I thank you for taking the time to listen to the webinar. Hopefully it was helpful, and I hope you have a great day. Thank you.